Hi, Xavier. My name is Nurse Brown. I'm coming in to do an abdominal assessment. Is that okay?
Mm-hmm.
Okay, I'm going to go ahead and wash my hands. And after washing my hands, I'm going to apply my gloves and come over and identify my patient and identify myself. And I've put my gloves on. Xavier, can you tell me your name and date of birth, please?
Xavier Lucas, 10/12/2007.
And I'm going to check your band. Great. Okay. So I'm coming here because I need to do a assessment on your abdomen. So the first thing I'm gonna do, I'm looking at his abdomen to make sure there's no abnormalities, that there's no bulging of his abdomen, there's no signs of cuts, bruises, and after observing his stomach, how he's breathing, to make sure there's no deviations intact. Um, the next thing I'm gonna do, I'm gonna ask Xavier, do you need to go to the restroom? You
No.
have to pee or anything?
No.
Okay, I'm gonna be touching around on your stomach, so I don't want you to be uncomfortable. When was the last time you had a bowel movement? When was the last time you pooped? You remember?
2 hours ago.
Okay. Did you look at the color, or
Brown.
it was brown? Okay. Was it hard, soft?
What type of question is that?
Was it hard, soft, or
Hard?
watery? Okay.
No.
All right. So you should drink a little more water. Okay. The next thing I'm gonna do, I'm going to auscultate Xavier. He's kind of not liking these questions, but this is normal, Xavier. Okay. It's don't feel
Mm-hmm.
like. Okay. So what I'm gonna do is, Xavier, I'm gonna start here at your his lower right abdomen quadrant, and I'm gonna just listen. I'm gonna take my bell. It might be a little cold, okay? And what I'm gonna do, I'm just listening to his sounds to make his bowel sounds, stomach sounds to make sure that everything is normal inside, okay? So this might be a little cold. And then I'm gonna go for about 5 to 30 seconds, and that sounds good. Then I'm gonna go up to the right upper quadrant, 30 seconds, which is good. Then I'm gonna go over to the left upper lobe, good. Then I'm gonna go down to the left lower lobe quadrant, about 5 to 30 seconds. The next thing I'm gonna do, I'm gonna actually go up right here in the middle here, and his and right here I'm looking, listening for any swooshing, and that's good. No swooshing. Then I'm gonna go over here by the iliac, the ischium crest. I'm listening there. Good. That sounds good. Next thing I'm doing, I'm gonna palpate, and I'm gonna feel for any um, lumps, or looking for any herniated. If he had a colostomy bag, I'll be looking at the color of the it's kind of rough doing it like that. Okay, so next thing I'm gonna do here, I'm just gonna take my hand and kind of move it in the lower right quadrant, and it's kind of pressing here. It's tight and intact. Good. He kind of ticklish. So what I would do with this, I would actually let him put his hands here and help me, since he was, yeah. You all right? Yeah. Let me see. I can feel it here. And then the next thing I'm gonna do a deep palpation. And that's feeling a little deeper. Let me know if it hurt, okay?
Okay.
And I'm feeling for any hernia, any lumps in his abdomen. Good. And after that, I can also listen in the growing area to see if I hear anything, if he complained of any in the femoral um area, femoral area. But since he didn't complain of any growing pain in the growing area, I'm not gonna go there. But after that, I'm going to ask him if he have any questions, if he's feeling any discomfort. Um, you feel any discomfort?
No.
And since he's fine, I'm going to give him his call light, go out and discard my gloves, clean my equipment, gather my equipment, and go and report my findings to the personnel.